Welcome to the Human Factors and Ergonomics Hub, a series of educational podcasts that showcase the connection between human capabilities and good work design, brought to you by the Human Factors and Ergonomics Society of Australia. Hi and welcome to the Human Factors and Ergonomics podcast. Today, my special guest is Steph Cassidy. Steph's passion lies in assisting Australian workplaces to maintain their maximum productivity. She is an occupational therapist and certified professional ergonomist and has 30 years' experience in managing and preventing work-related injury and illness. In 2012, Steph founded Productivity Matters, a business focused on helping to create productivity, healthy and safe places to work. Lovely to have you on board with us today, Steph. Thanks for joining me. How did you become interested in human factors and ergonomics?
I started as an occupational therapist, Sharon, in working predominantly in injury management in workplaces, and became quite disillusioned by the fact that I saw failures in work systems, failures in, just general environmental demands on people that just didn't fit them, didn't suit them, and they ended up injured. And both the human and financial cost to the business and to the person were huge. And I got pretty disenchanted by that fairly swiftly. Decided to have a look at some form of prevention course that I could do. I came across the Curtin University postgraduate diploma in ergonomics, and that's where my ergonomics journey started. So I did that some time ago now. And it just taught me about the sort of things that you can do to make workplace design more user-friendly and better suit their needs.
So where do you work now and what do you do?
I'm with Productivity Matters. I'm the owner of a very small consulting firm in Melbourne, and we focus on making workplaces healthier, safer and more productive with a combination of sort of ergonomists and health and safety professionals working together.
So I imagine that you work on different types of projects. Do you want to have a chat about one of the projects that you're working on?
Love to. We do work on many and varied projects. I guess you could say that we're probably more focused on both hazardous manual tasks and workplace design to reduce components of that. But the other side that we've been becoming more and more involved in more recently is the management of psychosocial hazards and risk as it presents in workplaces. So we're working on many projects in this regard at the moment, but I'll cover off on one probably more so than another, mainly because it's finished and we have actually seen some outcome measures that are really quite nice to share with the audience. So we did some work with a public transport bus service in Victoria. They employed over 1,000 workers from they're a very diverse workforce, multicultural. They came to us after an incident. It was quite interesting. They came to us where they'd had a manager who'd had a report basically of an employee that went to him with suicidal ideation, and it scared him. So he didn't know what to say. He felt very ill-equipped to respond. He obviously got the support of his people and culture team and many other people in the business to help him through that. But it made them realise as an organisation that they were quite ill-prepared for that sort of presentation in an employee. That combined with their people and culture manager, who was really quite concerned about psychosocial risk, knew about the term, had heard the regulator talking about it, had heard, it was starting to be bantered around amongst all of the, the forums that she'd been to. And she said, Steph, if we're going to do something around this, we need to do it properly. So she called me and said, look, I don't know what to do with this. I know we need to do something, and I think we need to do something around psychosocial risk. I just have no idea about how to tackle it. And so we were able to sit down and sort of scope out how we might go about that with her. And we sort of commenced a project in 2021, which was in the middle of COVID pandemic. And it was, it was new to them and probably quite new to us also as, human factors and ergonomics consultants. So we were treading on new ground. And probably used traditional management consulting kind of frameworks to help us through that project. But at the same time, we had to unpack a whole lot of new information around psychosocial risk that was, being made available publicly to all all industry really. So we sort of we went about it in a way that we, first of all, looked at all the tools that were available. So there's a number of different tools that organisations can use to try to assess what psychosocial hazards present. And I'm sure, Sharon, you know it, Joel. They're really just, it's anything really from a social factors, sort of organisational factor, or, environmental factors within our workplace that make us really psychologically unsafe or make us feel mentally unwell. It could be an emotional response. We might be angry, sad, anxious, so it's all of those things that, probably lower our mental wellness in when we go to work. So it's about addressing those factors of work that make people feel yucky and trying to make them feel, trying to reduce the risks associated with that or get rid of the hazard altogether if it's presenting in that workplace. And I guess it's complicated, right? Because it's very difficult to say, well, which parts of a design of work are causing people to have an emotional response. And so the frameworks that have been developed, there's multiple types. So we looked to many, and we kind of said that we think there's components of most that we can use, but we wouldn't use all in one. Not one tool was suitable to this particular workplace, I guess you could say. So we looked to many tools. Copenhagen Psychosocial Questionnaires, which is, I'm sure most people have heard about. People at Work tool, which was the regulators all got together and felt that was a good tool of use for most organisations in Australia. We then had in July, so we'd started this process, and then just as we were scoping the project, the ISO 45003 standard in occupational health, like psychosocial risk management, came out, and we kind of just went, oh, this is good, because that tied in really nicely with this particular organisation's work health, safety and management and quality framework, because they were ISO accredited. So it kind of went, okay, here we've got a tool that marries beautifully with the rest of the types of systems they're using to manage other parts of their work. So we looked to that as fairly strongly to help develop an audit tool. Now, most of the tools that have been developed are survey-based, and this organisation were very anti-survey. So they said, and for a couple of reasons, they'd just done a survey in relation to people and culture. So they said, our people are going to think that we're asking too many questions and not doing much at all about it. The second thing is they had a very diverse workplace. So 50% or a little bit over 50% of their workplace, English was kind of their second or third language. And so doing surveys in English were something that they didn't feel completely confident and comfortable with. They did feel like we could use in-person workshops would be a better way of actually getting information from their workforce. So therein lay the challenge, because we were in the midst of lockdowns in Victoria at the time, and the pandemic was eliminating our ability to get to these people in person, face-to-face, not virtually. They said they don't feel comfortable with tech, most of our drivers. So they really wanted us to try to reach out to them in person. And so we did do that. We did manage to do that in between lockdowns. So the minute doors opened, it was on. The logistics of booking workshops fairly swiftly around bus service rostering was difficult. And we obviously had to follow some fairly stringent guidelines around making sure that we didn't expose their workforce to COVID and vice versa. They didn't expose to us as consultants. So we met in car parks, we met in, we did all sorts of weird and wonderful things to actually ask questions that were derived from this psychosocial audit tool that we developed.
Oh, no, I was just going to ask you, given that it was COVID and you were all in isolation, or we were all in isolation, how did you sell this project to the workforce? Because if you just, roll up in the car park to talk to them, there's a whole lot of info missing beforehand. How did you do that?
That's a really good point. So we had someone internally that was really passionate about this project, and essentially they said we have to make sure that our comms to the team are really simplified, and we lead them up to this point. So We did a couple of things. First of all, we communicated to the workforce. They had an app by which they could be communicated to from the support office. And so, because at the time they weren't visiting the depot at all for lunch, which is what they usually did. So we couldn't put little notices on notice boards or anything. It all had to be done via this app. So there was a couple of things that happened. Their CEO made a commitment to do a 1-minute video that would be sent out via the app to all of the workforce to demonstrate his commitment to this process. The second thing was we sent really simple information. So we didn't call the words psychosocial risk. They used a term called Healthy Minds Work. And Healthy Minds was really essentially what the project was coined and used. That term was used throughout. The workforce then were communicated to and understood that there was something coming. They then asked for volunteers to commit to the hazard ID workshops, and they could actually let their team, their supervisor or service delivery manager, as they called them, know that they were keen to be involved. They did also quite strategically ask all HSRs to be involved, and they also invited union representation as well, because they didn't want, to get halfway through this process and have, perhaps someone say, why weren't we invited? We really wanted to contribute to this project. So, it was really well done. It was, really done in a way that it was simplified language. A message from the CEO is pretty amazing to have a 1-minute video. We helped script that for him because he was even nervous about talking about psychosocial risk. And so he just wanted to make sure he got that message, delivered in the right way. And so then from there, we also had the leadership team completely committed to the process. So they had said, we will commit time, we'll make sure rosters are changed, we'll, commit time to getting people into the workshops. If we can't get the numbers up, we'll do everything we can. Also, Sharon, what we did is we actually made sure that we interviewed the leaders first before we went to the workforce, so they understood the process and the type of questions that might be asked, and then they were more confident and comfortable in approaching the workforce to, get them to get involved. So it was interviews with leaders first, then hazard identification workshops with the workforce second.
So you've mentioned an app, so it's an opt-in, opt-out, so not everybody had to be involved.
No. Not everyone, no. And we were a bit worried about that because we actually said when we looked at the number of people that they could probably take off buses to put into workshops, it was only about maybe just a little bit less than 10% of their workforce. And we were concerned that that was not going to be enough representation. But what we did is we sense checked that against, so once we'd done the hazard identification workshops with the workforce, we looked at the desktop review information. We did a desktop review initially, but we looked back to that data to see whether or not we felt like it was reflective of what sort of things we've been seeing. So, incident reports, we looked at, some videotape of, the type of things that occur in buses. We looked at, the type of reporting that the leaders were pulling together for board reports, and it all added up. So it was all reflective of what they thought. And I guess that's one thing. A lot of organisations get a little bit concerned, psychosocial risk, what are they going to find? And I often say to them, look, don't get too concerned, because often it's anecdotally, you know exactly what's going on with your workforce, and you know it through different surveys you've done and just, talking to your managers. You know what's going on. This is just a way of probably pulling it together in some form of framework and verifying everything that you know through consultation with the workforce. So it's there's usually no surprises. After the hazard identification workshops and interviews with leaders were complete, we were able to sit down and map through the hazards and what sort of hazards probably were ranked using their organisational risk matrices. We actually tried to rank them, according to, whether they're low, medium, high, etc., extreme, whatever it may be. And then we took that to the leadership team in a summary sort of roadmap, and they agreed or disagreed or changed the level of risk based on their organisational risk. So it was a bit of toing and froing around, how should we rank that? What should we do there? Some of them we didn't decide on. We said, let's just wait until the end of the project and see where we think that risk lies.
I was going to ask what the top 5 may have been.
Top 5, occupational violence, of course, came up as a top 5, and I'll just refer to a little document I've got here for you. So one of the key areas that they had a problem with job demand, and that was more to do with the management team. So it wasn't so often the hazards are not necessarily identified for one cohort. They might be identified depending on the role of the individual. So there was job demands and workload demands on the management. There was remote work hazards with bus drivers, particularly at that time, because they weren't touching. There was no touch points at all in person with the organisation because of COVID. Poor organisational change consultation was one of the key areas that they found was an issue for their bus drivers. There were, of course, I think, did I mention OC violence? So definitely there was, I call it, customers, bus passengers behaving badly. And there was some around low job control, particularly in the call centre work, the guys that man the call centre for the bus service. Night shifts were particularly mundane and boring for them. There was a very mixed hazard identification amongst each job role. There were quite many and varied.
So once you identified what the problems were, what did you do next?
We went into, so it's all very well to have a lot of problems, but you've got to find some sort of solution to the problems. So the next step, first of all, we had to communicate those hazards to the workforce. So showing them that we'd heard them, that we'd listened, and that the leadership team said that there were areas that we needed to work on. That was what they wanted to do, is make sure that they communicated that to the workforce at that stage. Then we went into risk control workshops. So the same cohort, but some other. So we added some drivers in, we added some service delivery managers in who hadn't been through the process before. And we, because I guess they said the same cohort's easier because they already understand the psychosocial hazards, so you don't have to explain that again, which was good because they had helped us identify those. And then we did risk control workshops. All of these workshops were around an hour and a half each. So it's, an hour and a half to 2 hours each. And we'd present what hazards, the top hazards, and go through each of those and say, right, well, you're now the manager of this bus service. What would you do differently? How would you manage this? What suggestions have you got to reduce this hazard? Can we get rid of it altogether? Is it something that we just have to accept? Is it something that we shouldn't accept and we need to work on better ways of reducing other risks associated with the hazard? So they were amazing. So they came up with some incredible suggestions. It's interesting. We did it so that there were no direct reports involved in each workshop, so that they felt free to talk without their manager being there or their supervisor or whatever. So it was definitely free. It was once we started with them, they just couldn't stop. They were so into it, and I guess it took some really solid facilitation. From an ergonomics perspective, I kept going back to them and saying, look, from a systems perspective, it's all very well for an individual bus driver to have some sort of solution put in place, but how can we protect all of the bus drivers, not just you, all of the bus drivers? And so we kept going back to how we can impact on systems rather than just the behaviour or the training of the individual, because they kept falling back to administrative controls, which we all know are low order controls. And we kept going back to, let's go back and see if we can change the way this hazard presents and the system that caused it to present that way. So they became like little systems designers. And they were my, co-designers, and they came up with some incredible suggestions. I can give you a few examples if you like.
Yeah, that'd be great.
There was one particular example that came up where they had one of the bus drivers said he was in a fairly remote, regional area of Victoria. Bus broke down. It was near midnight. It was one of the last buses to go out. There were a couple of passengers. A couple were probably inebriated. He wasn't sure, but they might have been under the influence of something. And there was a mum with a baby. Bus breaks down, and he said, look, English is not my best language, Steph, but I was trying to explain to the call centre, which is where they take calls on breakdowns, that there were 3 different symbols flashing on the dashboard of the bus, and he couldn't explain the symbols. So he was going, it's like a triangle with a squiggly line underneath, and he was trying to, and it's red, and then there's another one that's flashing blue, and that's on the right-hand side of the steering wheel, and it was and they just couldn't communicate what was wrong. It took them 2 hours to respond. So he was trying to communicate via radio. He didn't have Wi-Fi, so he couldn't just take a photo of the symbols and send it to the workshop and show them. And that was a problem with the service. They knew that the bus service had black spots where they didn't have Wi-Fi coverage. So he was trying to explain it via CB radio, which wasn't working well for him. So he said, Steph, we've only got 7 models of buses, why can't we just have a laminated dashboard of all of the error symbols that are likely to come up on the any one bus model, have it sitting in our little folder, and number them 1 to 20. And then if we ring up the call centre, we can say symbol 1, 3, we're on model number C730. It's symbol number 1, 7 and 6 that's flashing, and they can immediately contact the workshop and tell them what it is. And then because what happened when they did eventually get out to the bus is the guy got on the bus and went, oh, all you need to do is press this button and hold that one down. The bus would have restarted. It was just an error. And he'd sat out in the freezing cold in the middle of the night with passengers in there, and a highly stressful situation. So he said that was a very frustrating occurrence that happened regularly with bus drivers.
I can only imagine how frustrating that would be. The same thing, I guess, occurs, though, of course, if it's a violence. So can I maybe just jump there for a second? In the participative groups and the work that you did, what are some of the controls that you came up with to manage violence?
That's interesting. They felt, interestingly, through all of the hazard identification, they didn't feel that was a huge risk, because they felt that that's the one area of focus that the bus service had continually tried to improve and make better for them. So things like putting protective physical barriers between them and passengers. They talked about de-escalation training they had was excellent, and they wanted just a little bit more on that, maybe even virtual reality training to show them what it's like before they get on the bus and become a bus driver, how to regulate, how to de-escalate. Interestingly, we didn't have to cover that in terms of suggested risk controls. They actually felt like they knew they were doing a good job in that area. And actually, when they said, "Well, we think we're doing a good job in that area, but can you use this process to actually verify that we are?" And it did verify that. They felt quite safe in terms of they knew they had duress alarms, they had response material, they had they had mentor drivers that assisted them in understanding how to de-escalate. They had a whole lot of staff that was available to them, and they also knew that they had support in EAP post if they had an incident that was really harsh. The interesting thing, though, that did come out of that, it's not necessary. They felt like they were dealing with violence well, but the response to an incident was not good. So the service level agreement that the bus service had with the government included a reporting on customer complaints, which were always investigated, and they were the terms used in the feedback: customer complaint and investigation. So there was a downplay on the amount of reporting on violence. So, for example, verbal abuse, or because they felt if they reported it, that they would be investigated. So that was an outcome. The suggested control there was, can we change the language that's used to customer feedback instead of customer complaint, and change it to reviewing incidents rather than investigating incidents? And then we will more likely be less likely to have a fear of retribution as a result of reporting. That's really interesting. Were you able to evaluate some of the controls that were put in? What I didn't say at the beginning was the project was actually funded by their insurer through risk management funding, which is a fund, obviously, I'm not sure if it's across Australia, but it's a fund in Victoria that's accessible to employers when they pay a certain premium, that they're able to access. Component of that is towards injury prevention. And they chose this particular project to and made an application to their risk management funding. So as a result, the risk management the funder itself wanted to make sure that the language used in outcomes was very aligned with what they wanted. So the things that and the things that they were looking for were things like claims performance, so a reduction in the number of mental injury claims. They were looking for a reduction in the claims cost and duration, particularly mental illness. They also wanted to make sure that the high-risk claims were reducing, so psychological injury claims were reducing. So the workplace, however, definitely wanted to see a change in suicide response. So suicidal ideation or verbal, reporting of that and how to respond to that. They wanted that addressed, but they also wanted to see an increase in EAP usage because they had very little. They also wanted to see an increase in reporting of incidents. So people had a better understanding and they were reporting more, and they had less fear of retribution, so they were more likely to report. So the outcomes, what they did do, one of the suggested risk controls was to provide mental health, not first aid training to the managers, but a similar type of training covering the most prevalent illnesses they're likely to see in their workforce, which were anxiety and depression. And they also wanted to make sure that they were trained in how to respond if someone reported suicidal ideation. So all of their leadership team and all the way through to service delivery managers, which is the level that would look after the workforce directly, were trained in that, which was fabulous. They also trained up some mental health first aiders who were a first point of call for those leaders if they felt even after the training they weren't able to address that issue. So they had a few people that were mental health first aid trained. Their claims performance decreased, so the number of psychological claims that were submitted the year following the project reduced. It would reduce by 8 per annum. The claims and cost duration, now this is interesting, the cost per claim had risen, but the total cost of claims per annum was reducing. So the cost per claim, we think, rising was a result of there were some long-term claims still amongst that, and they were still obviously premium sensitive, so impacting that result. Then obviously their EAP usage had increased to, it had doubled, so it had doubled in its use. They're trying to get to industry standard of 5% usage. They started below 1, so they were well on their way to achieving that. Overall, also, they felt that it opened up communications. This is anecdotal reports from them. It had opened up communication between them and the workforce. It had not necessarily improved retention rates because they'd had pretty high retention rates anyway, but they felt like they were able to connect with their workforce so much better. Like it was one of those. They were very proud of what they'd achieved, and as a result, they were so proud that they actually submitted for a WorkSafe award, and they won the award in 2022. So with WorkSafe Victoria, and that award was for it's like the best mental health commitment to prevention of mental injury award, and they were one of the 8 that submitted across that award across multiple industries. So they were very proud of that result.
Just want to bring you back. You mentioned job workload and job demand came up, and I'm just wondering how you addressed some of that, whether fatigue was part of that rostering.
Rostering and fatigue was absolutely something that came out of it. One of the suggested controls was actually to bring in a fatigue and shift working specialist, and they decided to time that fairly carefully around the development of their EBAs because it tied in with enterprise bargaining agreements. So they decided that they would delay the onset of bringing in a specialist in that area until it was incorporated in the lead up to the EBA, because it was always a discussion that came up in the EBA. So they felt if they had a specialist involved who could work with them on that, then they would incorporate the recommendations into the EBA where they could. So that was an interesting outcome. The other thing about workload and demand was more about the managers. They were overloaded with customer complaints from the public. So having to respond via email, and a part of their service level agreement is they had to respond to 100%, and they had to respond within 48 hours. So it was like a time sort of tight. It was time tight, and they were time poor. So what they did is interesting. That the bus driver that was sitting in one of the workshops said, "So we've got a call centre that's a little bit bored at night time, who can all type, and they're quite educated people and they're really good with English. And we've got a whole bunch of managers who can't get to customer complaints. Is there any way that we can actually have the call centre guys support the service delivery managers?" And so they worked together. They actually just got together and said, "How can we help?" And they said, "Well, first of all, you can write some email templates that we can use and make our email response system leaner. And they even rewrote some of the emails to make them a little bit more positive, and they sort of gave it a little nice spin to them. So they ended up actually developing a whole automated response system for them, teaching them how to use Outlook. They developed templates for them, and they literally stripped by 2 hours a day the work from the service. It's from each service delivery manager, 2 hours a day in responding to the public. So it was a massive,
that's
huge. They couldn't believe it. They just literally felt like the weight had been lifted off their shoulders. And they said, now we can go down into the lunchroom and hang out with the bus drivers during lunch breaks and see how they are and see what's going on. They even developed a really lovely wellbeing indicator that the bus drivers could, on their app, that they could actually indicate how they're feeling that day when they get to work. So it opened up, I'm not so, where am I on the wellbeing spectrum? Am I in the green zone, or am I slipping down into the red zone? And that way the supervisor could ring them and say, "Hey, I can see that you've checked in. You're looking, like you're in the orange zone. What's going on? Is there anything we can support you with?" So it's an open conversation immediately. The service supervisors, even though they haven't seen the bus driver in the morning, they know how they're going, and they can actually reach out to them and sort of do a check-in if they're not going so well.
Was there some fear from the drivers that information could be used to stop promotion or something in the future?
Not at all. In fact, one of the outcomes of the suggested controls was they have a thing called a mentor driver. And the mentor drivers are the guys they teach all of the new drivers that come in. They sort of just sit and coach on the bus and help teach them about, how to drive well, how to interact with passengers, how to get the best out of your driving experience. And they weren't recognised in any physical way. So everyone kind of knew who they were. But if you were new to the bus service, you wouldn't necessarily know who the mentor drivers are, or because the mentor drivers were also known to be behaviourally really good. So you could, they were known to, and chosen for that role because they were just so lovely with all of the workforce. They managed up well, and they also responded, and mentored the whole workforce. So one of the drivers said, "I think they need to be recognised." So reward and recognition came into it, where they said, can we put them in like a different coloured vest, or put a little bit of badge on them, or, mentor driver on the back of their uniform, so that we know who they are and they're recognised, because their behaviours were so lovely. They're such great people that we want people they should be recognised for what they do. And so, that was an outcome that came about as a result of a suggested control is, we really should be recognising and rewarding those people who are doing, a great service to the bus drivers and helping management.
They become a peer support system, really, don't they? I imagine.
Yeah, really strong. And they were so admired. They were almost like the granddads of the place. They'd been there for a long time. They were longest serving, but just had such huge belief in the actual company and what the company could do. So they were just beautiful. They were such lovely people. The other suggested control, you'll never, after being through the pandemic, the one key thing that every single person in every workshop said is bring back our barbecues and our coffee days. So they used to get a little coffee cart out to the depot, and they'd hang out, they'd all chat and talk across the coffee, and the coffee was put on by the company, and they used to have barbecue days where they'd, pull out a barbecue, to put on a few sausages, have a chat. And they said, we need those because we've lost touch with each other. And they, it just made you realise that, and they just felt very isolated being out on the road all the time and not being able, they had to eat in the buses. That's where they couldn't really go beyond their bus. That was their lunchroom as well for that period of time. So just connecting with each other was something that they, desperately wanted.
One of the things about bus driving that, in my experience, that I've heard is that the way the rostering is often worked out is that there's literally almost nowhere to park the bus. So a driver can actually go to the bathroom if required. I'm just wondering if that kind of simple fact came up.
I do remember it coming up, actually, Sharon, but I can't remember. And interestingly, I think there was a joke in one of the risk control workshops. Thank goodness we don't employ many females. So I think there were multiple trees found, parks found. That was the sort of that was the comment that was made. Not a big issue for them. They weren't worried about that. But definitely having somewhere to come back to communicate with and have a rest. I think also having a rest from the bus was something that they said absolutely needs to come back very, very quickly after that we'd been through the situation in Victoria that we had. Yeah, they were very keen to get off that bus for a bit.
So tell me about some of the challenges with this project.
COVID. So getting people together was the biggest challenge. I think that's it, because they were so committed from, CEO level down. It was, I suppose, communication. I was concerned that we had to be very cautious about the way we communicated, especially given it was via an app. So we used symbols and infographics and stuff like that to try to make it as easy to read as possible for them. Barriers definitely was English being a third or fourth or fifth language for some of them. So that absolutely was one of the barriers, and we had to be very cautious and careful about that. But otherwise, look, it went remarkably smoothly, given that it was during the time it was. And I think that's because we had an internal person. Well, they had a lot of commitment internally, but then we had one key person that was driving it internally that made everything happen. And they were very committed to getting it to work.
Were there any responses that you didn't expect?
No.
Okay.
There were a lot of ideas that the managers were very happy to hear, and they go, "Why didn't we think of that?" That's the one thing, the gold that you get from it, is when the managers go, it's kind of a bit of a weight lifted off our shoulders that we don't have to think of all the solutions for these hazards. It's a workforce-led solution, and they literally sit there and go, "Why didn't we think of that?" Like, it's just, complete gold, and they loved it. So, and they were so happy to get that, when it was all chunked together and you show them an action plan and a roadmap and a full risk register and solutions that were sitting there waiting for them to implement, they were like, "Oh, this is just fantastic. This is so easy," and it's a weight off our shoulders that we don't have to think of everything.
I'm wondering whether you liaised with the EAP service providers. Obviously, there's mixed responses with EAP services. I'm just wondering, what leverage did you, or how did you reach out to them to make that more effective?
No, we didn't. So they were just in the process of reviewing the EAP provider when we started the project. They had lost faith in their current EAP provider. So and also, I guess they did see that more as a response and support service rather than a preventative service. So they kind of put them in that bucket. Yeah, they were changing things up there. They said, "No, leave that alone. Let's just completely focus on prevention." And sort of they were very concerned that they were going to end up, particularly the work health safety managers, they were concerned that this wasn't going to be, it needed to be a risk management approach. They were very keen on it being a risk management approach, not turn into let's just give more counselling and response to this. They wanted it to be, no, we need to get rid of the hazards. And so I don't think they viewed the EAP provider as a provider of injury prevention. What
do you think could have been done differently, with the exception of COVID, of course? What would you do differently next time?
Not much, actually. Look, it probably would have been better if it was quicker. I think it was delayed because we had so many, gaps in when we could get hold of the workforce. So because it lost a bit of momentum, like you had to be very clear with communication again. You'd have to go, okay, so remember we said 2 months ago that we were going to do this. Now we're actually starting to do it. So we had to keep sort of communicating throughout, because otherwise it would have just lost its spark. So yeah, it was about, and also probably probably want to work more with the management team in implementation plans. We sort of handed it over and they said, we've got it from here. But helping them through that would have been, I think it would have added weight and got those done a little bit more quickly, and maybe even educated them a bit more on how to implement some of the suggested controls and demonstrate measures. So measures, I think we missed an opportunity to measure well. We measured in terms of what the funders' requirements were, but we could have measured a whole lot more in outcomes to the business. But we missed that opportunity.
So this is a dynamic process. Staff will change, things will change for the organisation. So how did you build in a dynamic response?
Yeah, it's a really good point. I didn't do that. So the person that was driving the project internally she's kept that hat on. And so what she was planning to do was actually, so they had a full psychosocial risk register as a result of it. And so what they needed to do was revisit that, and they were going to revisit it quarterly to say, what's changed in our business? Has there been anything that's new, different? For example, the service level agreement with the government could change, and that could change a few things for them. So they just said that they were going to revisit it quarterly and then do further consultation with different groups within the business to see, same process, hazard identification workshops as well as risk control workshops. And to that point, the person who was involved in driving the project, as well as the people and culture manager, were involved in all of the workshops, all of the stages they attended, so they could learn how to facilitate those types of workshops, and then they were going to continue that process. Now, it's funny you should say that, because we have had a change in people and culture manager since, and the other person has gone on parental leave. So that's my next step was to contact the CEO and just say, hey, how are you going? And is someone taking care of this for you? Let's not let it drop, because you've done such a great job.
Thanks for joining us at the Human Factors and Ergonomics Hub, brought to you by the Human Factors and Ergonomics Society of Australia, where human-centred design really matters. If you like this podcast, make us your favourite in your podcast app. We look forward to chatting with you next time.